Polycystic ovarian syndrome, PCOS, is the most common reproductive disorder affecting women in their reproductive years, occurring in 5 to 10% of women. Women with PCOS have an increased risk of infertility due to a lack of ovulation. A significant proportion of women struggling to conceive ultimately need assisted reproductive technology. However, as you can see, there are various consequences of the use of these treatments. Therefore, IVM has been suggested as an alternative option. IVM is an alternative to standard IVF which accomplishes the maturation of immature oocytes in the lab. However, there are still concerns regarding its use. Due to the lack of research, an important question was raised. Does IVM treatment yield different results in women requiring IVF due to subfertility from PCOS compared to women with subfertility from all other causes? This study is a systematic review and meta-analysis. A search for the studies to contribute was conducted on PubMed with these search terms and restrictions. Studies meeting these criteria were deemed eligible for the study, and these studies were excluded from the research. This is the process that was used to eventually end up with 11 studies included in the meta-analysis. This resulted in a total of 808 patients, split unequally into those with PCOS, those with PCO, and controls. These are the 11 articles used for data extraction in the study. The primary outcome measured was live birth per woman and per cycle. These additional outcomes were also measured. Odds ratios, along with their corresponding 95% confidence intervals, were calculated for each of the outcomes and used to compare these three subcategories. This table shows the results found in the meta-analysis. Odds ratios greater than 1 denote more frequent outcome among the first component in the A versus B comparison of the two subgroups of each column. From this, we can see whether there were higher rates for women with PCOS or without for each outcome. For example, higher rates for clinical pregnancy in PCOS women can be seen, lower cancellation rates among PCOS patients is seen, and there are no observable differences for maturation rates or miscarriage rates. The results of this study provide evidence for IVM being a preferable approach for subfertility treatment in women with PCOS during an IVF cycle as compared to those without PCOS, and this is derived from the findings of these outcomes. These limitations occurred in the meta-analysis. Ideally, the different subcategories would be equally sized groups, and as only one study reported on congenital anomalies, no conclusions could be drawn. Future research is needed to confirm the findings of this review. Studies with a follow-up period greater than 10 years are needed to examine any potential developmental or congenital anomalies of the offspring from IVM, and future studies of larger sample sizes are needed to reduce error.